This is the Merit Omni Pro first in bag for the Roseville Fire Department. You'll see it has a top pouch on here, and this is what we call our vital signs pouch. For everything on your routine medical calls, this will be the pouch that you're going to go to the most. It has all of our diagnostics or our vital sign equipment. In here you have your glucometer and your Massimo SpO2 monitor, as well as back here is our thermometers. In the other pouch here you have your stethoscope and your blood pressure cuff. That's just the regular adult size one. Moving to the outside of the bag, we have these front pockets here. And this one on the left is a SAM splint, some Curalex, and an ACE wrap. And on the right here, we have ice pack, a chest seal dressing, the Israeli bandage, and a cat tourniquet, as well as your needle decompression needle. Kind of a big trauma pouch. On the top pocket here, we have sick bags, N95, and simple mask, as well as some basic trauma. We have a multi-trauma dressing, abdominal pad, 4x4s, 2x2s, large bandages, small bandages, nose clamp, and tape. And then over here in this small skinny pocket, we have a light for checking pupils, a ring cutter, and then a triangular bandage if you need to do a sling and swath. Over here is the main compartment. So in theory, we tried to design this bag to not have to open it for just kind of our routine medical calls. So most of the interior stuff is for a little more invasive procedures and more critical calls. Right off the bat is our IV start kit. In here, we have 2 IV start kits, a few different options as far as needles go. We have 2 of the 18s, 2 of the 20s, and singles of our other sizes. We have our bag of fluids, a sharp shuttle, tubing for the fluids, and a few different flushes. The bags are removable by Velcro. Over here, we have our IO kit. We have trauma shears for cutting off clothes if you don't happen to carry shears on your person, the IO drill, a pressure bag, a bariatric, and an adult size needle. Again, this pouch is also removable, so if you were in a scenario where you needed to pass this to somebody at the feet of the patient so they can perform this procedure, you can do that. Use the clip to open it up. On this flap, we have our basic nebulizer kit. Over here, we have a simple mask for an adult, or I'm sorry, a non-rebreather for an adult, a pediatric non-rebreather, and an adult nasal cannula. On the inside of the bag here is our CPAP, our bag valve mask, and an oxygen tank. These 2 interior things, this is our medication pouch. Carries all the medications that we give or administer at the EMT basic level. And then this blue pouch is mostly what we would consider our airway pouch. You can remove the inner pocket. This has all 3 sizes of the eye gels that we carry for adults, a rescue pod, a tube tamer, and then nasal and oral airways, as well as lube and an OG tube that slides down the side of the eye gel. And the intent with this is also to be able to pass this to the front of the patient or the head of the patient if you're in a cardiac arrest scenario. That's the Omni Pro first in bag for the Roseville Fire Department.